So we know that there's strong evidence for the benefits of exercise for people with knee osteoarthritis, knee and hip osteoarthritis and chronic low back pain. But we also know that people really struggle to adhere to the exercise, particularly in the long term. And we know that adherence does matter and that the benefits of exercise are often not maintained long term for these people. So we need to find interventions that can help to improve and maintain adherence to exercise so that we can see the maximum benefit. So we conducted a systematic review and a meta-analysis, and we had quite strict criteria for our review. There had been 2 previous reviews conducted, but both of those had quite broad criteria where they included studies where people were doing perhaps different kinds of exercise, or where the adherence intervention was compared to a group that wasn't even exercising. So we wanted to only include studies that had what we call contextual equivalence, which is where both groups are doing exercise and then the only difference is the adherence intervention over the top. So we conducted, as I say, a systematic review, and we did that as a 2-step process where we screened abstracts and titles and then full text to then decide on the articles that were to be included. And then we assessed the quality of the intervention reporting using the TIDIA checklist. We assessed the risk of bias using the Cochrane risk of bias, and then we synthesised the evidence using the GRADE approach. So what we were really aiming to find out was, do interventions that aim to increase adherence to exercise actually increase adherence to exercise among people with chronic low back pain or hip or knee osteoarthritis? We found that a few studies actually meet our strict inclusion criteria. So we screened almost 5,000 articles to begin with and ended up with 9 papers included in the study. So we found that accurate reporting of interventions was often a problem in multiple studies, which made it difficult to then compare the studies and made synthesis of the information quite difficult. We found that there is limited high quality evidence specifically for interventions to improve adherence to exercise in these populations. We found with our meta-analysis that there is moderate quality evidence for the use of booster physio sessions to improve adherence to exercise. And we found individual studies that showed some emerging evidence for the benefits of patient motivational strategies or the use of behavioural graded exercise. But we certainly know that more good quality research is needed at this stage. Clinicians may consider including booster sessions when they're planning their physio program for someone. So having follow-up consultations, having a block of intervention, and then perhaps follow-up consultations more than 3 months down the track. We know from behaviour change theory that, that this just helps to maintain that relationship, and also allows clinicians to keep checking on whether patients have got any issues with the exercises themselves, with their condition, or with their adherence to the exercise. So we're currently planning randomised controlled trials looking at a number of different strategies to specifically improve adherence to exercise. One of the strategies that we're evaluating is a targeted SMS, so text message service, in response to patient feedback with how they're going with their exercises. We're also looking at the validity and reliability of the measures used to assess adherence to exercise, because we found that across the studies they used a large number of different outcome measures, and very few, if any of them, actually have any evidence for their accuracy. We know that adherence to exercise is complex in any population, but it's often influenced by different factors depending on that population. So whether we're looking at adolescents, younger working age people, or older people who perhaps are retired and have different things going on in their lives. So I think we would find different results, particularly with the interventions that were looked at in this study. A number of them had quite a significant time commitment in terms of going to programs or attending classes multiple times a week, which might just not even be realistic for for younger people. But I also think that technology offers multiple different options these days for interventions. And we didn't include any studies that specifically used new technology, but I know that they are taking place in lots of different populations, so that's an exciting area. So there are certainly a lot of different mobile phone technologies, so whether it be SMS, so text reminders, that sort of thing, or an app is popular. There's lots of different apps these days where people log in and they mark off when they've done their exercises, or they video their exercises, and then their clinician can then look at that and check in on what's happening. And then for younger people, again, among children, there's a number of different game-based sort of things to help them do their exercises, no matter what, sort of depending on their condition.